Good morning. This is Drew Holley. I'm with BIS Benefits. This is America's most boring podcast. And yes, we're talking about employee benefits today, in particular, how to reduce small business health insurance cost. Well, how small is your business? All right. Are you 20 employees? Are you 10 employees? Are you 50? And some small businesses think they're small at 250 employees. So depending on that, there's different strategies. But high level, there's a couple things you can do. If we're talking about reducing costs for the employees, just pay 100% of the cost. There, I solved your problem. You're the employer. Employees are complaining about cost. You may only contribute half. Pay 100%. Employees are happy. But your overhead isn't. And yes, I say that a little tongue-in-cheek, but it is a simple solution. If the employees are complaining about the healthcare costs, they're usually complaining about how much is coming out of their paycheck. That's the number one. Number two, I don't feel like this carrier, Aetna Blue Cross United, is the best option for me. Okay, well, what deductible do you have? Do you even need that deductible? Why are you only offering one health insurance plan? You should offer the employees 3. Okay, 2, 3. Anything outside of 4, if you have less than 100 employees, is a little overkill. That can reduce the cost without increasing the overhead from the employer. If you adapt a policy that says, hey, I have a bucket of $600 a month, which is about average, what we see in the marketplace, slightly above that for employers to contribute towards health insurance. Here's a bucket of 600. I have 50 different health insurance plans to pick from. I'm going to narrow as an employer down to 3, and I'm going to let the employees make the best cost choices. Well, it's not uncommon. We come across employers with only one plan, and even if they have 2, the cost spread difference between option 1 and 2 is only saving the employees $10 a month. Well, that's not a big enough difference. So you can reduce your employees' expenses without increasing your overhead by really just small-minded thinking in the industry, but sometimes it's big for employers if they've never heard it. Offer a $1,000, offer a $3,000, offer a $6,000 deductible. Let the employees choose. So that's a very common strategy. Another is bundling with your dental and vision with the same medical carrier. That can get discounts up to 5%. We've seen in the marketplace. Another strategy is the network. Maybe your employees are okay sacrificing a few doctors or hospitals in the area for costs of plans lower as much as 20%. Now, that needs to be well educated to the staff. They need to understand that. That goes to the broker's open enrollment material and communication. But that's a strategy. So you can offer within, say, Blue Cross or United Healthcare. Here's a plan with a skinnier network, much lower. Here's a plan with much broader. Let your employees choose. That can reduce their costs. Of course, the carrier who you look at, and then the funding type, fully insured, self-insured, and really businesses below 100 employees. One of the most popular here in the state of Georgia are called level funded, balance funded, alternate funded. They're essentially self-funded without the scariness of traditional self-funded. Those are all ways you can reduce your cost. Again, plan designs like HRA and HSA. If I'm sounding like a military officer with acronyms, if you would like it broken down in more simple terms, we would love to have that discussion with you and show you. It doesn't have to be scary, but there are a lot of strategic things you can do to lower healthcare costs. Sometimes these things have been exhausted and you're still faced with tough healthcare costs, and that can happen. So at BIS, we're in the business of dealing with reality, but we really try to give you as much strategies and options on the table to lower costs. And the last thing I would say, insurance, just like any other product or service in this country, it's going to be driven down if there's options, if there's negotiation. So if your broker isn't proactively looking at every carrier on the healthcare side before your renewal's even released, 60, 90, 120 days before the renewal, that is one of the best way to lower the cost, is simply show the incumbent, hey, if you don't come off your increase or your rates, we're going to walk. They'll probably try to get away with it. And so that is a very simple mechanism that you can choose right now if you choose the right advisor, broker, agent, whatever you want to call us. So if you'd like a second look or a second opinion, feel free to reach out to BIS. Thank you.